Have you ever wondered why, when a top politician in Nigeria, or a businessman, or an influencer, when they fall ill, they travel places like India, UK, or even America for their treatment? Well, look no more, because today we got someone in the medical field with almost 4 decades of experience. You know what 4 decades mean? That's not a small number. So we'd like her to introduce ourselves before we proceed.
My name's if I say Mrs. Nwachukwu, I think I'm belittling myself.
Wow.
My name is Lady Chief Breeder Nwachukwu.
Wow, that's very, very beautiful. Mommy, first of all, I say thank you for, bringing out time from your busy schedule to honor my invitation to this very podcast. And I'm very, very grateful for that. Then before we proceed to the main item that brought us to this very video, I would like to go a bit inside about her journey in the medical profession. So before we proceed, Mommy, what inspired you to pursue a career in the medicine field, and what motivates you to continue doing that even till today?
Medical practice is a humanitarian job, and even when I was a young lady, we had a hospital in my house, and that's where I saw human beings as ladies practicing nursing, decent dressing, punctuality, neatness, their eagerness to help life.
Yes, yes, yes.
That made me, even as a young girl, as early part of my life, to say, I like these people and I want to be like them. Even during those days, someone came when I told my people I want to be a nurse. They said, no, sister, don't marry you. Nobody marry them because it's assumed they know everything.
Yes.
And I said, no way. Whichever way, I want to be a nurse.
Wow.
And that made me to say continually, even when I had a little challenge about my O level, I continued to take that paper to make sure that I did that nursing. And today, I am a nurse and I'm proud to be a nurse.
That is very, very beautiful.
Even if I retire tomorrow, people calls from here and there. Do that, help me, even if it's just an instruction.
Yes.
I said, I have joy and I am very satisfied with the work as a nurse.
Yes. Wow. That's really, really great. So, what are some most pressing challenges facing Nigerian healthcare system, and how can it be addressed?
Thank you. You know, this country, I will not go into politics because I'm a nurse. And, if you ask me, I tell the nurses they don't indulge in politics.
Definitely.
Because they don't have such time, especially called nurses, because they have a lot of things to
Exactly.
good. So, but what are the challenges in the medical practice in Nigeria? A lot of things. You think that we have many nurses, many doctors. They are not enough. Going by the trade of this time. Now, the challenges are too many, but I'll mention a few. Poor governance is one of the challenges. Because I tell you, I will be in a medical center as I practice in medical center. You won't see what to practice with. And that makes your work so boring. You see somebody that you will see what to practice and what to do. But you know what to do, but you have what to use. You can't use this your hand.
Exactly.
And you can't do miracle in nursing and in medical practice. We are not given enough things to practice. And that is the cause of exodus of nurses outside.
Yes.
Medical practitioners going out. Actually, our pay is in heaven. That's what we know. Because we cannot be paid enough.
Exactly.
Going by what we do. And so, little pay, small pay. We call it steep pay. Even if we are paid a whole lot of money, it is not enough as what we do in nursing. You feel somebody dying and you are already crying inside you and you are taking care of that person. It's not easy. So the pay is small, no equipment, enabling environment, manpower is small. That are the challenges of medical practice in Nigeria.
Wow. Well, that's a lot because even me looking at it, one can exactly confirm to what you just said because you know that the way this country is going, nothing is being managed very well, and the government doesn't care about it. But here, the government are putting the blind eye to it and deaf ears to their complaints, and things are just getting worse day by day. So we're also using this. I'm also using this avenue to also beckon on our government to take care of our medical sector as well. So before we proceed, do well to like, share, and comment your thoughts in the comment section while we move on. On the next, what are the some yet effective ways people can prioritize their health and prevent common illness? You know, we Nigerians, we are very, very careless when it comes to health. We prefer to hustle and tussle. At the end of the day, we are deteriorated, yet we still don't care for our health. So, what are the effective ways people can prioritize their health?
Thank you. There are many ways. When I said there are enabling environment, some people that don't have home,
Exactly.
they don't have environment. Those that have environment, they can't take care of the environment. You know, most of the sickness you see around here is out of our carelessness. We don't feed well. Where will you get money to feed well? It's because when you feed well, you have immunity.
Yes.
That immunity will help you to fight even those diseases when they come.
Yes.
That is one, low immunity. Because you cannot, you go to the village and tell somebody, eat a balanced diet. What is balanced diet? And where would that person get that balanced diet?
Exactly.
Though the little things in the village will also make us to have a balanced diet. It is not even possible because of the cost of life now,
Yes.
cost of things around us. You go take fruit, take this. Where will you get it? And going by those things, going by that condition, it is not easy to say prioritize one's health simply. Another way is going to the hospital when you have a change and going for checkups for our elderly. Then when you have a sick person around you, take that person to a qualified hospital or a personnel, not going to anyhow chemist mix serum, and by that you are endangering that person's life. That is another simple way of taking care of our health in this country. Another way is that if the government will help us to provide the little amenities that can help us, but if the actions are not forthcoming, I wonder how a common man in the village will help him or herself to attain health.
You know, this is very, very an important point for me because you know we have subsidy in fuel which have already been removed. I think there should also be a subsidized something like subsidy in the health care center. Reason being that not everybody can afford medical bills. You know, people are living in poverty, especially here in Nigeria. People are extremely living in poverty that they cannot even afford medical attention to themselves or their kids. Just like recently, a story trending on social media about a man who lost his wife because he cannot, his pregnant wife, because he cannot afford 500,000 naira for deposit. Honestly, things are really going out of hand, and this one only came out because I know a lot of cases have been repeating. It's just that they are not coming to social media. A lot of cases are repeating in different hospitals because of this. Because if the condition of Nigeria was good, at least the man would have been able to afford the medical bills. I know many are blaming the man, reason being that then they are now like he should have prepared enough, knowing that his wife is pregnant. For me, I'm like, are you not in Nigeria seeing the way things are going? Is it easy for you? Nobody knows what the man is passing through. Nobody knows if he can even afford 3 square meal a day. No, definitely, this is not funny. Nobody knows how things are, but yet many because when I saw the post, I went to the comment section. Some people are blabbing, you should have prepared. I'm like, you can never be too careful. You cannot be too sure. So please, we are pleading on the government, at least if there's something like subsidy in the medical field, that would at least help a lot. Then,
That man I saw carrying a dead wife.
yes,
In such case, I have not commented on such a case, but what I'm trying to say, for reoccurrence, the person should go to a place closer and where he can afford it.
yes,
Because going to big hospitals, you can be doing tests, doing that, the person will just go.
yes,
So if the man has run into a private hospital where the wife could be taken care of, maybe the wife wouldn't have died in pregnancy. It's a very painful condition
Exactly.
for a woman to die in pregnancy or even during childbirth. It's very an awful situation. You see a child in the womb struggling for air because the woman is no more breathing.
sure.
It's a very painful situation. You would have tried elsewhere. Like we said, balanced diet. Where will you see balanced diet? Do you have savings yourself?
Maybe.
So most people, they don't know what they are saying because they are somehow comfortable in their own
Yes,
in their own homes. But average in Nigeria, there is nothing like savings
yeah, of course.
as to say prepare. But I know that a family that is expecting a child should prepare as early as possible. So we cannot blame them because the situation is so out of hand. Going by that simple, effective way of health, in getting our healthy situation, please, we should not forget our personal hygiene and
Yes.
keeping our environments
Clean.
clean. Because what are we battling? Mostly malaria. If we can avoid it by keeping our environment clean, avoiding mosquito bite and all whatnot, if we can. I think we can do that one.
Definitely.
Little exercises.
Yes.
I think that's what I can say.
Well, that's really great. Of course, that's really great. That's for people who want to learn. That's for people who want to learn.
We should learn. We
Of
should
course.
learn because there's no money to go to hospital.
Definitely. How can we ensure that everyone in Nigeria have access to quality health care, regardless of their socio-economic status or location?
This that should come into the hand of the government. They are the people to provide. Nurses are ready to go into the village. I remember when I was Mater Hospital, twice in a week we'll go into different villages to give them treatment. If we see anyone that we cannot treat them, carry them back to the hospital.
Definitely.
Making health care accessible, making it available, making it even cheap for
Yes.
them in the village. Sometimes we will go and our car will get stuck there in the mud. We will continue. These days they are not there. Go to the health centers in the villages, you cannot see paracetamol.
Exactly.
Go to the health centers in the village, you cannot see a trained nurse. You only see a Jew who may not know much about. I was quarreling with one when I was a student midwife who was giving every pregnant woman that will come in, give broken penicillin. We started quarreling her. What are you giving these women? And he said, if you give them paracetamol or other drug, they will say and charge them. They will find it difficult to pay because they want that injection. So I will now said, no, now give them Bico injection so that and with that you are helping them instead of killing them with broken. What are you treating with that? So having qualified nurses, qualified health personnel, even doctors in the health, this our health center will help the villagers, will help people in the rural area to get qualified and subsidized treatment. So I'm taking it to the government, employ more nurses in the health center, equip them there, and let them be enlightened. Regularly, they will go for seminar, go for training. At least that will equip them to make healthcare accessible and available to the people in the grassroots.
Yes.
They are the people suffering. That's my answer.
Wow, that is very good. That's if our government will hear because they already turned their
They have to.
Of course. So now, what advice would you give to a young person or young people who are interested in pursuing a career in medicine or in healthcare sector?
Thank you very much. That is where I said it should be a calling.
Yes.
No parents, I mean no parents should force a child to go and read nursing, go and read medicine, go and read lab scientist when it is not that child's goal, because that child will not do good in that. So what my advice to parents is that leave them to pursue their desires. That is one. Another one is that any young person that wants to be a nurse, I myself as a nurse or be a doctor, I said that you should go ahead and do that. It's a nice one. It's a nice career. But one thing is this: don't carry in your mind that nurses are well paid, they are rich. Please, they suffer. Before you go into that, make sure you have agreed within yourself. Let me go and help my fellow human being who is in pain, who is suffering, who cannot do what that person is supposed to do when he's healthy. Go and do that. When you have that call, when you have that charisma, that go in and do it, you do very well. My advice is that they should go in and do and forget about the monetary aspect of it.
Yes.
The services is the most important thing you should look into when you have the call. My advice.
That is very, very beautiful. Now we are about to review the most important question, which is the main reason why we are here today. But before we proceed, if you like what you are saying, do well to like, share, press your hand on the plus button, and also if you are watching on YouTube, subscribe and press your hand on the button on the notification bell to be notified whenever we drop our video. Now, let us proceed. Why is it that when Nigerian politicians or top businessmen or all the celebrities and influencers, when they get you, they love traveling outside the country, places like India or America or UK specifically? On most occasions, they like to travel to UK for their treatment. Does that mean that Nigerian doctors are not qualified enough to handle those cases, or what?
Thank you very much. That is the bone of contention.
Yes.
Now, when you go to these places you just mentioned, most of the doctors, most of the nurses there are Nigerians. Why are they trading well there than here? The issue is not that they are quackery. Those here are quack doctors, are quack nurses. I am telling you, it's because you've not given them what to do, to work with. Provide them with what they should work with. They will do perfectly well. Why they go out there is that they have made that place. The people, the governance, the people around there, they have made that place very, very okay for such treatment. But
Yes.
yeah, the people that are supposed to do that, they are not doing it. You go to that India, you get, even they use these our herbs. They come here, collect it, go there, refine it, and use it,
Yes.
and treat our people. But they collect whatever they are using from here. So our government should answer that very well. Why they are going there is that the place that are the people that are in charge of that place have made that place what it is to them. They don't want to make this place if that should be better than those places. So nurses and doctors in Nigeria are the same thing there. You see them every part of this world.
Yes.
And are the people even going to take care of them there? Why are they there? One is they have not been given all those things necessary. They have not made the environment very comfortable for them to work. They've not given them equipment, drugs, and the most importantly, the training needed to take care of those things. Not that they cannot do it or that they are quackery. If you give Nigerian nurses and doctors an opportunity like that, they will equipped with, they will be more than any other person in the world.
Yes.
Because we are all talented in the art, except those that have just come into the profession as they are looking for money only. But those of us that are called for it, please, my dear, we can do more than those people you see there. The issue on it is that we have not been given what equipment, drugs, training, and all what's not, enabling environment to do their job. And another thing is that most of them are going there because of their health insurance allowances.
Yes. Yes.
To collect it, their health insurance votes. That's what I was told. So they will go there. Why are our country giving them such chance?
Health allowance.
Yes, their health allowances, their health votes. You go there. They carry their parents, they do headache, they will go there to make sure. Anyway, greener pastures. We are not blaming them.
Exactly.
So but what I'm only advising is that they should make this place as comfortable, at least a bit comfortable for those that cannot afford flying out there. At least we are still the same. Flesh and blood.
Well, thank you, Mommy, for taking out your time to explain this to us.
Thank you very
Honestly,
much.
I really appreciate it. And also to my viewers, if you find value in this very topic, do what you like, share, and also comment your thoughts in the comment section. And most importantly, we are pleading on our government. Honestly, Nigeria is a very great place to be. That's if our government make it comfortable for us, at least. Our basic communities, if it is being met, nobody will be quarreling with anybody, nobody will be throwing anybody on contention or anything with anybody. Because health is one of the most important part of human life that we need.
No, health is one.
Of course.
One of the most is the one.
Yes.
Because when you are healthy, you will do any other thing.
Yes.
But when you are sick or you cannot get assessment to help yourself, please, you cannot do anything. You cannot do it. So health is very, very important.
Definitely. So our government should look into it. We are pleading with our government at this very point in time to look into our health sector, to renovate it, put in more money to our health sector so that the poor masses can also benefit from it. Thank you. Let's